Welcome to Med-Surg Mini number 7, where we'll talk about the basics of the immune system. To start off, immunity is the mechanism the body uses to fight disease. There's two different types of immunity, both innate, or also called natural immunity, or adaptive, also called acquired. Innate immunity is the barriers our body has to prevent any infectious bacteria from getting in. This can be a physical barrier like the skin, a biochemical barrier like our saliva, or a mechanical barrier such as all the cilia in our respiratory tract. Another part of our innate or natural immunity is our inflammatory response. Adaptive or acquired immunity is acquired through natural exposure to antibodies or transfer of antibodies. This is broken down into two different types of immune response, the humoral response or the cell-mediated. Another way to categorize immune response is either by being innate or adaptive. Innate immunity, like I said, is those protective barriers such as skin, mucus, and protective barriers. Also, tears, saliva, sweat, and earwax prevent any infectious material from entering our body. And then also processes like sloughing, coughing, sneezing, vomiting, and urination. Innate immunity has no memory or is considered nonspecific, and it differentiates between self and foreign through the major histocompatibility complex, also called MHC. If the major histocompatibility complex designates that something is foreign, it initiates an immune response. The immune response aims to destroy foreign cells and stop invasion of infectious particles. It does this through inflammation, which causes vasodilation of capillaries and vessels. Along with this vasodilation, leukocytes move to the tissue site and phagocytize any foreign particles, which means to eat them up. Then it produces fibrous tissue to facilitate healing. Symptoms of inflammation includes redness, heat, edema, pain, drainage, fever, chills, malaise, and increased white blood cell. Adaptive immunity is immunity that develops after birth and can be passive or active. It involves the cell-mediated response, which is when a foreign antigen is recognized by an APC complex. This then initiates activation of the maturation of T cells, and the T cells then stimulate production of B cells and cytokines. This then causes phagocytosis of those cells that are marked by the antibodies. The second response is the humoral response, and this is when the antigen matches to an antibody. When they bind together, this causes the cell to divide into plasma and memory cells to secrete more antibodies. The antibodies then, once they bind to the antigens, clump together, and this is called agglutination. And then the clump of cells can be phagocytized. Another part of the humoral response is opsonization, and this is when the antigen-antibody complex is coated with substance to facilitate that phagocytosis. Here's a little chart that describes how that is broken down. So on the left, you can see the process of innate or natural immunity, which is nonspecific. We have our first line of defense, which is all of those barriers that prevent pathogens from entering, and our second line of defense, which is our inflammatory process. Then we have our acquired or adaptive immunity, which is a specific form of immunity, and this is our third line of defense. Again, it can be naturally acquired, either actively, through our body building up immunity to the infection, or passively, which can be done through maternal antibodies through the placenta. It can also be artificially acquired through vaccination, which would be active, or passive through immunoglobulin therapy. Age-related considerations when we talk about the immune function is that infants' immune system may be dependent on the mother and the mother's breast milk because they haven't had a great opportunity to build up their immune response and their memory to pathogens yet. They also may not have received immunizations that have helped protect them from different pathogens. They also have underdeveloped organ function, which can impact their response to infection as well. Children start to acquire immunity, and in older adults, we see a lot of mechanisms that decrease their immune response. This is things like atrophy of their thymus, so this increases their risk of viral infections. They have poor defense against tumor cells, so they have higher rates of cancer. They have increased autoantibody production, so they have higher rates of autoimmune responses. We also see a decrease in B cell production and increased malnutrition, which impacts our immune system's ability to fight infection. Components of the immune system include our lymphatic system, our lymphoid organs, and our immune cells, which we'll break down. In the lymphatic system, we have our vessels and collecting ducts. Our lymphoid organs include the thalamus, the bone marrow, the spleen, tonsils, adenoids, higher patches, and lymph nodes. Immune cells that we'll talk about include leukocytes, which are broken down into T lymphocytes, B lymphocytes. We also have cytokines, the complement system cells, neutrophils, basophils, eosinophils, monocytes, macrophages, and dendritic cells and mast cells. To start off, immune cells, we'll talk about leukocytes. So leukocytes are formed in the bone marrow and lymphatic tissue. They then move to the thymus and bone marrow where they mature. Since they are mobile, they can be found in many organs and throughout the bloodstream. There's two different types of leukocytes: granulocytes, which have granules and release histamine and pathogen-fighting substances, such as our neutrophils, basophils, and eosinophils. And then we have our agranulocytes, which have no granules. And these are going to be our monocytes and our lymphocytes. As I mentioned, our granulocytes include neutrophils. And the purpose of a neutrophil cell is to phagocytize foreign particles to destroy bacteria. And they're one of the first responders on the scene. Our basophils release heparin, anticoagulants, and histamine to help with that immune response. And they're also considered an early responder. And then eosinophils phagocytize, destroying allergens and parasites. As far as our agranulocytes go, monocytes aim to produce the adaptive immunity response. So they deliver pathogens to the T cells and then develop into macrophages. They can also activate helper T cells, which help to activate killer T cells, as well as B lymphocytes, which we'll talk about later. And then we have our lymphocytes, which help with humoral immunity and cell-mediated immunity. They are formed in the bone marrow, but can be found throughout the bloodstream and within many organs. So to break down the lymphocytes, as I mentioned, there's B lymphocytes, T lymphocytes, and there's also immunoglobulins. Our B lymphocytes help with humoral immunity, and they mature into antibodies and immunoglobulins. Then they bind to antigens to mark those antigens for destruction. They often differentiate into plasma cells as well as memory cells. The plasma cells secrete more antibodies, whereas the memory cells produce antibodies based on antigen recognition. So once your body is exposed to a foreign particle, it produces memory cells. So the next time that that particle enters our body, our cells already know how to respond to that. Our T lymphocytes help with the cell-mediated response, and they eliminate cells infected by pathogens. There's different types of C lymphocytes, and they are categorized as cytotoxic, which fights foreign cells, tumors, and viruses. There's suppressor T lymphocytes, which are activated by helper T cells to stop immune response when it's no longer needed. Then we have our helper T cells, which help build that adaptive and innate immunity. They activate macrophages, those suppressor cells, and B cell antibody production. And then we have our natural killer cells, which target viruses and tumor cells. As I mentioned, immunoglobulins are antibodies produced by B lymphocytes. And these immunoglobulins can be broken into 5 different categories. Immunoglobulin A is located in secretion glands, breast milk, sweat, saliva, mucus, and tears. And the purpose of IgA is to protect the mucosal lining from microbe invasion. IgD is found on the surface of B lymphocytes, and it helps with B cell activation. IgE is often the least abundant, but it facilitates any allergic reactions, and it helps to fight parasitic infections. IgG is the most abundant, and it can be found in the placenta as well as throughout our body. And the purpose of IgG is to fight and phagocytize bacteria, viruses, and toxins. Then we have IgM, which is made by B cells. It is aided in the initial antibody response and activates the complement system. So continuing on with immune cells, we have our dendrites. Dendrites are a form of macrophages, which basically phagocytize foreign cells. They're found in lymphoid tissues, and they are a potent antigen presenting cell, or an APC. They produce a major histocompatibility complex while engulfing antigens, and this releases cytokines and starts the innate and adaptive immune responses. Mast cells are granulated cells found in the skin, respiratory, and GI lining, and they release heparin and histamine. Mast cells are found in abundance when someone is having an allergic reaction or anaphylaxis. Cytokines include interleukins, interferons, and tumor necrosis factor. These cells respond to antigens for acquired immune responses. In order to be activated, the action of the cytokines is to initiate inflammation through the interleukins and the tumor necrosis factors. They also signal other cells to the site of infection so that they can come and initiate the immune response. They stimulate leukocyte response, especially interleukins, and then the interferon cells protect against virus and tumor growth. The complement system is proteins that kill cells in both acquired and innate immunity. They're synthesized in the liver and they migrate to the bloodstream to where the infection may be. They're activated by exposure to bacteria, virus, fungi, tumor cells, antigen-antibody complexes, and endotoxins. Now moving on to the organs that are involved in the immune system. To start, we have our lymph nodes and lymphatic system. Our lymph nodes are small glandular structures that store lymphocytes and monocytes. The lymphatic system aims to filter and phagocytize any invading particles, and it also absorbs interstitial fluid not absorbed by the bloodstream and tries to get that back to the bloodstream after it's been cleared of those invading particles. The thymus is an organ located near the heart. It's often larger in childhood but shrinks throughout adulthood, and it produces a chemical called thymosin. Thymosin stimulates T cell production. Then the thymus also helps to store and develop those T cells. The bone marrow consists of myeloid tissue, which has both red tissue, which is active, or yellow tissue, which is inactive. The purpose of the bone marrow is to form and differentiate B and T cells. B cells will remain in the bone marrow until they're needed, and they can be used to differentiate, and T cells are sent to the thymus to mature. The spleen is located in the upper left quadrant of the abdomen, and the purpose is to filter blood. And it produces either red pulp, which is damaged or old blood cells, or white pulp, which is unwanted debris. And this is a diagram of how the bone marrow aids in the production of immune cells. So we have our humoral immunity. Like I said, it produces B cells. The B cells mature in the bone marrow, and they differentiate into B lymphocytes, which can help with memory cells or plasma cells in the creation of antibodies. It also produces T cells, which then move to the thymus for maturation, where they can develop into regular T cells or suppressor T cells, or they can develop into effector T cells, which are those helper T cells and cytotoxic T cells. Then we have our tonsils, adenoids, and Peyer's patches. The location of Peyer's patches is near any mucosal surface. The tonsils are located between your palatine arches in the mouth, and then adenoids are at the nasal pharyngeal border. The purpose of Peyer's patches is to protect against invading microorganisms. The purpose of your tonsils are to protect against pathogens that are inhaled, as well as adenoids. They initiate an immune response against any inhaled pathogens. There are multiple factors that affect immunity and how our body responds and initiates its immune response. One factor includes liver disease. Liver disease can decrease our neutrophil, phagocytosis, and immunoglobulins that are produced. Malnutrition can decrease our white blood cells and neutrophil counts. Pulmonary disease can decrease our neutrophils. Radiation therapy can decrease white blood cells and damage our mechanical barriers to infection. Renal disease decreases neutrophils and immunoglobulins. A splenectomy forms the inability to recognize and engulf foreign particles. Surgery damages our mechanical barriers and reduces neutrophil counts. And trauma disrupts our barriers as well and introduces foreign particles into our body. Immune dysfunction can be categorized as primary or secondary. Primary immune dysfunction is deficient or limited immune function at birth. This is often genetic or congenital with some environmental influences and is often diagnosed early in childhood. This includes defects with T lymphocytes, B lymphocytes, natural killer cells, phagocytic cells, and our complement system. Secondary immune dysfunction is due to damage to the immune system from environmental factors. This can be diagnosed at any point in life, and the damage is often due to medications, chemicals, irritation, chemotherapy, malnutrition, burns, and other diseases. When we're assessing immune function, we want to get a health history. In particular, we want to know about allergies, the medications they're on, and if there are any immunosuppressants, their surgical history, their health history, their family history, and especially if they have a genetic component of any autoimmune disorders or any disorders that lead to immune dysfunction. We want to know their social history, in particular smoking and alcohol intake, because that can lead to impaired immune response. Also, if they're doing things like IV drug use, it can increase their exposure to certain pathogens. We want to know if they've had any recent travel, especially to countries where they're not used to the pathogens that may be around. And then we want their immunization history. Our physical exam is going to include taking their vitals, looking at their skin and mucous membranes, palpating their lymph nodes and feeling for any swelling, which might indicate infection. And then we're going to review their systems, looking for systematic signs of infection, like fever, fatigue, changes in mentation, changes in respiratory status. We're assessing for any loss of appetite along with nausea and vomiting. We're looking at their joint and muscle pain and stiffness, any swelling, edema, heat, things like that. To diagnose immune disorders, we can take blood tests, in particular a CBC with differentials. The differentials will indicate if there's an early signs of infection. We can do genetic testing for any of those genetic related immune deficiencies. We can look at inflammatory markers, especially if we're suspecting an autoimmune disorder. And we can do antibody testing to see if the body has been exposed to an antigen and started producing those antibodies. We can also do a skin test, which is a type of injection where we expose the skin to different things that the body may be allergic to, and then we look for any immune response to that. We can also do bone marrow aspiration or biopsies and measure the content of the bone marrow and how effectively they're producing those B and T cells. And then we can also do radiological imaging, such as a CT scan, an MRI, and a PET scan. And that wraps up the very basics of the immune response.